Or if you're going to a school where there are very low asthma rates, very low absenteeism rates, people seem to be performing academically up to their abilities. The question is, how much of the success of that school is based on the indoor environmental quality?
Welcome to the Passive House podcast, brought to you by Passive House Accelerator, a catalyst for zero carbon building. For news, inspiration, and connections from all flavours of Passive House, check out passivehouseaccelerator.com. Sign up to receive regular updates about events, get your questions answered, and contribute to the community dialogue. There's loads of free information for experienced professionals and people just starting out on their Passive House journey. We hope to see you at one of our weekly Passive House Accelerator live webinars. You can also check out our Reimagined Buildings YouTube channel for some great inspiration for both building new or renovating. In the meantime, here's this week's Passive House podcast. Welcome back to the Passive House podcast. Great to have the whole team back this week. We've got Zach coming to us from Seattle. How are you, Zach?
I'm well, thank you.
And Ilka, how are things in Philadelphia?
They are pretty good. Thank you.
And Mary as well.
Good here in California too.
Nice. Well, we're gonna jump straight into things pretty quickly this week because we've got a really good interview which Mary and Ilka did. So before we jump into that, let's thank some of our supporters, Zach.
Indeed. So a big thank you to our founding sponsors, 475 High Performance Building Supply, Baxt Ingui Architects, Glavel, Minitaire, Partel, Rockwell North America, Stocorp, and Zola Windows. Also a big thank you to our champion sponsors, Bewizo, Gradient, Icon Windows and Doors, Intelligent Membranes, PH Air Seal, Proseco, and Source 2050. And a big thank you to our stakeholder partner, NYSERDA, the New York State Energy Research and Development Authority.
So we've been chatting a little bit about stuff that's happening around the place at the moment that's relevant to Passive House and the building industry. And Zach, you caught something interesting this week about carbon emissions.
I did. I learned something new this week. I learned something new pretty much every week. So what I wanted to share was the big news from Architecture 2030. So Architecture 2030, of course, is the organization that is often quoted when we say buildings are responsible for X percentage of global CO2 emissions. And I think a lot of us say they're responsible for 40% of CO2 emissions, which is almost accurate in terms of the previous the data that was first shared by Architecture 2030, but it's actually the built environment. So it's a combination of buildings as well as infrastructure. So highways and light rail lines and dams and all that, and that's mainly concrete, iron, steel, and aluminum. So what I learned that's new this week is that Architecture 2030 has updated its aggregation of this data, and the data comes straight from the International Energy Agency. And what they found is that 40% number was actually an underestimate of the true impact of the built environment on CO2 emissions, and that the true number they believe is actually 42%. And the way that breaks down is that buildings operations are responsible for 27.3% of global emissions. The construction of buildings, so embodying carbon, is responsible for 7.7%. And the infrastructure embodied carbon is responsible for 7.3%. So when you take those embodied carbon numbers and put them together, that 7.7 plus 7.3, it means that embodied carbons from mainly cement, iron, and steel and aluminum is responsible for 15% of global emissions. One other thing I think that's interesting to note from this is that when you just look at buildings and you separate out the infrastructure, when you look at buildings, 78% of buildings emissions is operational carbon, and 22% is embodied carbon based on this new analysis. So we got some fresh numbers to play with.
Yeah, and that's useful and interesting. Thank you, Zach. Of course, is that the global average or the US numbers?
Global.
Right. Yeah. Because those numbers look. I mean, New Zealand's the anomaly
Right.
around the world because so much of our power is from hydro, and there'd be parts of British Columbia I would imagine would be the same, where our portion ends up being around 15% from the built sector, primarily because that operational contribution is so low because of our generation. We're not burning as much coal or gas to generate the electricity to run our buildings. That doesn't get us off the hook, though. And certainly in Australia, it's much closer to those average figures because they do rely heavily on coal, although transitioning away to that as much as they can with solar and wind. But I think it just really highlights the impetus that is required and the influence that we can have in architecture and buildings to make a really big dent on those global emissions. I mean, that's getting up to sort of half of all of the emissions. A big chunk of the other half, I think, is agriculture and heavy industry. So, we do have a role to play, a significant role to play in getting those numbers down.
Indeed.
Awesome. All right. Well, thank you for that. Good to keep an eye on that and up to date with the research that's coming out. Mary or Ilka, I'm not sure who reached out first, but can one of you tell us how you came across Dr. Stephanie Taylor?
Well, actually, I reached out to her because Zach mentioned that he had heard her speak briefly at the Building Science Summer Camp in Massachusetts. And so I reached out to her because I wanted to hear more about the health impacts of spending time in buildings.
So let's jump straight in. This is Dr. Stephanie Taylor of Building for Health.
Today we have with us Dr. Stephanie Taylor. She's the CEO and founder of Building for Health. Dr. Taylor, could you tell us how you got interested in this intersection between design and health?
When I embarked on my quest to be a doctor back when I was quite young, I never in a bazillion years dreamed that I'd be thinking about buildings and mechanical systems and design. But when I was in med school, I went to Papua New Guinea for 4 months to, have a little bit of a break from the Harvard Medical School academic scene and have a bit of an adventure. And when I was in New Guinea, I was really worried when I looked at the surface hygiene of the hospitals or the clinics where I was working, because there's dirt on the concrete floors. A lot of people don't wear gloves, even in the operating rooms. And so I thought, these people are going to have a lot of infections and it's going to be very sad. The clinical outcomes are going to be tragic. And yet the patients in New Guinea did really well. And then when I went back to the Harvard teaching hospitals in Boston, with pristine, hygienic-looking surfaces, I became more and more aware of the epidemic of healthcare-associated infections. So as I looked at the sort of the cohorting of infections in the hospital, I began to think that the built environment had something to do with the transmission of healthcare-associated infections. I didn't know anything about buildings. The facility managers got annoyed when they saw me coming because I took up their time and didn't really know what I was talking about in their view. But anyway, so as I continued to do medical work in pediatric oncology, and I became more and more convinced that the built environment had a significant impact initially on patient outcomes, but eventually I began to realize that the indoor environment has a huge impact on our health in general, whether you're a student or whether you're at home or in an office building. And yet, physicians in the medical community wasn't talking about indoor air quality or talking about HVAC settings or, designs or materials beyond things like off-gassing of, VOCs or perhaps the presence of lead or asbestos. But I felt like there was a real gap in using and managing the indoor environment specifically to enhance our health. Again, I didn't know anything about buildings, so I went back to school in my 40s and got my master's in architecture and designed hospitals for about 7-8 years, so I could really understand buildings. After I got my master's and designed hospitals, I began to see human health as a building performance metric. So, for example, if you're in a home where you and your family, don't have very many viral illnesses or allergies or sensitivities, that could be due to your home. Or if you're going to a school where there are very low asthma rates, very low absenteeism rates, people seem to be performing academically up to their abilities, that would be, the question is how much of the success of that school is based on the indoor environmental quality. So I really began to use health outcomes and health performance as a building metric in sort of a very labor-intensive consulting model. So, for example, in a hospital, it would be collecting all the data that I could from hospital records. And then if I had a hospital that was willing, correlating the patient data with the conditions in the patient room. It's really time-consuming and a slow process. So somewhere around 2020, I thought, okay, how can we do this in a way that's scalable so that we can really reach more buildings and hopefully help more people? So that was the origin of my current company, Building for Health. And so what we do now is, and what I was talking about at the Building Performance Summer Camp, was how you can monitor and specifically see the indoor environment through the lens of human health. So to do that, what we do is we monitor 11 different components that we know are very important for human health. And then we have a cloud-based algorithm that determines the impact of those things on the human body. So, things like particles, gases, ozone, VOCs, carbon dioxide, carbon monoxide, combustion byproducts like sulfur dioxide and nitrogen dioxide, as well as humidity and temperature. So putting all these metrics together and evaluating and quantifying the effect on your body. But it's really interesting because it's not these things. If you think about it, like if you make a soup, you don't just taste the garlic or you don't just taste the tomatoes alone. You taste the interaction of these ingredients. And with indoor air quality and human health, it's the same thing. PM 2.5 by itself isn't what's affecting us. It's PM 2.5 in the presence of your humidity level or your ozone level or whatever the other components are. So we also look at how indoor chemistry reactions that occur in the air affect your body. So we look at it very holistically. And the findings are sometimes surprising. That was a really long answer to your question.
I mean, first of all, amazing that you just went back and got a master's in architecture because you wanted to learn a little bit more about buildings and then went on to actually design hospitals. I mean, that's pretty impressive. So if you look at indoor air quality, I mean, for you, it's just so obvious how much impact it has on our daily lives. But do you feel that there is an overall acceptance? Like, does everyone understand how important it is? In the medical community, but then also homeowners or gym owners, for example. I mean, those are all places where we spend a lot of time every day.
No, I don't think people have an understanding of how important it is. And I think the biggest, in my experience, probably because I'm a physician, I'm absolutely appalled at how little medical community knows about the importance of the indoor environment on our health. And there are lots of reasons for that. I think it's not, in the US, it's not profitable. Prevention is really not a profitable approach. And that sounds very cynical, but I think that's absolutely true. Even, for example, pulmonologists who take care of patients with cystic fibrosis, where, dry air is really damaging to the viscosity of the mucus in the patient's airways, which contributes to infection rates. But you tell a pulmonologist that they need to help the patient manage the humidity in their bedroom if they live in a northern climate, in the wintertime where you bring in air and you heat it and it dries out. The pulmonologist would be like, we don't do that. We don't think about proper humidification. So it's absolutely not in the awareness of physicians or providers. for the most part. I mean, there are some exceptions, obviously, but in the engineering communities, it's also a heavy lift, because engineers say, look, we do testing and balancing of equipment, not human beings. It's a topic that has really fallen between the cracks.
And you came from Harvard. That's where you went to school, and you continued to work at Harvard. Is that correct?
Yes. In my primary work is building for health and trying to, gain more acceptance of this concept of monitoring and evaluating the indoor environment. But I do work at Harvard still. I'm an inside health fellow, so I help innovative groups. I work in the infection control steering committees at Mass General and Brigham and Women's hospitals.
Isn't there some Harvard public health research going on IAQ and indoor air quality and health outcomes?
Absolutely. For example, Joe Allen at the Harvard School of Public Health wrote 2 books called Healthy Buildings. And Joe, I don't know if you're familiar with his work, but he is really, along with the pandemic and wildfires and Joe Allen, the concept that the environment and air quality is impactful to your health has become more in the limelight. There's a big difference, in my opinion, between Joe's approach and Harvard School of Public Health in general, and, for example, my approach as a physician, because I think it's one thing to look at your exposure in a building, your exposure to SARS-CoV-2 virus, either on particles or in droplets that people sneeze out, or looking at exposure to, radon or VOCs. And that's one aspect of how the indoor environment affects our health. But the other aspect, which is really powerful and is still a blind spot, is how does the indoor environment affect your immune system and your metabolism and your microbiome? You're probably familiar with the microbiome in your body. Well, buildings have a microbiome that is shaped by how a building is ventilated, what materials are used, the use patterns. But the impact of the environment on our bodies, on diseases such as inflammatory bowel disease or cardiovascular disease, that's an area of study that is really neglected. And even at Harvard School of Public Health, it's more about reducing exposures to specific things rather than supporting your immune system.
It is really amazing. I mean, you're completely right that you go to doctors and the air that you breathe in from your home is definitely the last thing you really investigate or think about. And coming from the passive house side or the architect side, whenever we hear any kind of complaint about the indoor air quality, it's mostly just something that the occupants notice within the building, like mold growth, right? Or the floorboards actually bow up or they shrink. Like that's something that people witness, or that's something they bring up. And that's the reason why they say we need a humidifier or we need a dehumidifier. But I don't think I've ever heard feedback from an occupant saying, I don't feel right, and that's why I think my home is not performing correctly. So it's really, really interesting.
And it's such a powerful tool. The pandemic has been a tragedy, but it has made people aware, at least, of exposures. And the problem, and what you just said, which is really interesting, you've talked about things that people can perceive. For example, you can perceive the temperature, or you can perceive if your floorboards are uneven or creaking, or you can smell certain odors. But what about all the things you cannot perceive? I think the buildings that I honestly believe come closest to truly being healthy buildings are ones where you don't have these rapid ventilation rates. Even ASHRAE 62.1, has sort of prescriptive ventilation mandates, but they're not responsive to what's actually going on. And for example, one of the problems in temperate climates is in the wintertime, when you bring in air and heat it up, is low relative humidity. And this was one of the findings early on in my research in hospitals, where we found that when the indoor relative humidity was below 40%, patient infection rates skyrocketed. And I was completely confounded by that. I thought it was an erroneous finding. But it ends up when the air is dry and at levels that your body doesn't necessarily perceive, there are more airborne particles. The pathogenic bioaerosols are the ones that can survive in a dry condition. Your mucosa in your respiratory system does not protect you as well. But dry air is something that most people do not know is hazardous to your health. Most people, you say humidity, and they instantly think of high humidity, how uncomfortable that is.
You mentioned COVID. Have you seen a growing interest in ventilation questions and approaches and its impact on infection rates since COVID, since the pandemic?
Yes, definitely. And for example, ASHRAE, I work a lot with ASHRAE in the Epidemic Task Force and now the Environmental Health Committee, but ASHRAE just came out with a standard called 241, which was rushed out in 4 months. It's how buildings can be managed if there's an infection risk, an airborne infectious disease risk. And so, yes, there's definitely a lot more interest in people addressing it. I don't necessarily agree with all the findings, but at least it is, being addressed. And what I don't agree with necessarily is that high ventilation rates is the solution to everything. I don't agree with that. Because number one, you can spend a lot of energy ventilating. If you don't know the quality of your outdoor air, you could be introducing contaminants. Your energy expenditure can be unnecessarily high. So that's why in my work, I'm a real fan of monitoring the indoor environment and the outdoor environment so you know when you need to remediate and how. And frequently, it's not just bringing in outdoor air. Frequently, it's managing your humidity. It's recirculating. It's other steps that are more energy efficient.
So going on to your Building for Health system and your systematic approach, can you tell us a little bit more about, what you're aiming to achieve with that system?
So what I personally am aiming to achieve is that every occupied building in this world would have monitoring so that you know what the conditions are and how to manage those conditions to support health and learning and all sorts of health conditions that are related to that. But, getting there is easier said than done. But our goal really is to create visibility in the indoor environment, to create visibility around how indoor air is impacting your health. So bringing perception to things that your five senses can't perceive. There's a lot of obstacles and there's resistance. Somebody's afraid that if they collect data on the indoor environment and somebody gets sick, then the building owner or manager could get sued. The liability risks are significant. ASHRAE is reluctant to, and building codes are reluctant to even really strongly recommend monitoring for the same reasons. They're already overwhelmed with costs for managing their buildings or their HVAC systems, and then you recommend that they monitor on top of that, and they think they're going to have to spend more money. They're like, no, we'd rather not know. So our goal is to create a platform that's easy to use, it's very affordable so that people have that visibility. It's kind of like driving at night. You don't want to go on the highway, or you don't even want to go on your backcountry road with no headlights. And yet that's really what we're doing in buildings.
Well, that's a great analogy. I'm actually curious if you see a correlation also between building materials, like if you use more natural building materials, usually they deal with moisture a lot better than non-natural building materials. So is that something that you measure as well, and that where you can tell what the building material or what the building is made out of?
So we don't measure that with our company platform, but the fact that you said that, if a building is made with wood or concrete, like untreated concrete or stone, or some surface that has micropores, your moisture management is so much more effective. And it's brilliant. I mean, Mother Nature really figured it out perfectly. passive design's figuring it out again. But I truly believe that building materials and the choice of materials is going to become one of the essential components for managing your indoor air. I mean, it's already important for energy conservation and harvesting energy use, but using building materials to actually adsorb, get rid of contaminants, or to hold moisture to help modulate indoor humidity is just, it's a perfect way to go. And vernacular architecture, is much more tuned into that. And even when you look at things like the survival of SARS-CoV-2 on a porous surface that can contain moisture versus stainless steel, guess which one eradicates the infectivity mechanism of the virus faster? Stainless steel or a porous surface that can hold moisture?
I'm going to guess a porous surface.
From what we just learned, right? About humidity. Yeah.
And there are good studies out there, and yet I think, again, human nature is you sort of hold on to things that you believe.
With your Building for Health, which has, I understand, triple components here, a sensoring suite, an analytical platform, and then a dashboard for the occupants to be able to see what the outcomes are. Have you had this installed in buildings? And if so, what kinds of buildings? And what kind of outcomes are you expecting people to, given the dashboard, are you expecting people to react to what's on the dashboard? Or can you just tell us a little about that?
Yes. I mean, so yes, we do have our platform installed, and I can tell you where and what we're learning. And it's really interesting. One of the sectors where we're having the most successes in senior living communities, I think for a number of reasons. One, the business model of a senior living community is aligned with keeping your beds occupied and therefore keeping people as healthy as possible and not being sent back to the hospital for viral illnesses. So we have a lot of maybe 15 different senior living communities being monitored. We're still a startup. So, our numbers are not as robust as I would like, but anyway, and we've discovered things like, number one, you don't want to charge your electric scooters next to the craft room because the ozone from the recharging scooters interacts with the craft off-gassing and creates particle levels. So we're like, let's move your scooters somewhere else to charge. We are finding that, for example, in bingo night, particles get really stirred up. And so it's important to manage your indoor humidity so it's not too low, so people aren't inhaling those particles. We're finding that even in northern Minnesota after the fires, even after the particle levels came down, ozone levels stayed high. And so it was better for outdoor activities to be suspended for a couple of days during the high ozone levels. So we are monitoring buildings. It's more of a uphill battle than I'd hoped. Again, for some of the reasons, people are already overwhelmed. People worry about legal implications. People think, well, I can't do anything about it anyway, so I don't really want to monitor. These are some of the obstacles we faced.
But think of the outcomes that you've been able to perceive. I mean, who would have thought of worrying about charging electric scooters near where you do crafts? I mean, that's not something that leaps to mind.
For me, what's also fascinating is what you just described with just looking at several aspects of your environment, not just one, right? Because one might be not great, but then if you add more humidity or, something else, it might be okay. So I don't think I ever really thought about it that way. I always thought about good and bad, right? But not that you can balance several things out against each other. So that's really, so is that something that you can see on your app and make decisions based on that, or how does that work?
Yes. And ultimately we're hoping that we automate the responses, but for now what we actually recommend, we deliver a score, and we deliver one score if you just want, 100 is excellent, below 50 you need to do something. And then you can break that apart into the different, into gases, particles, thermal. And then if you want to drill down even further, you can look at the individual levels. But our score reflects the interaction of all of these metrics. And our remediation recommendations also are made based on the interaction. So for example, if your outdoor ozone levels are elevated and you have like a non-toxic level of, say, NO2 inside from cooking, or say VOCs from materials, if you need to bring your score up indoors, we'll be very careful about recommending outdoor air because of the ozone. So we do make our recommendations based on this interactive chemistry, but you can see what's going on. And it's interesting, because if you have high particles indoors and it's dry, we'll say, manage your humidity. And doesn't mean you necessarily have to buy a humidifier. Maybe just turn your thermostat down a couple degrees, because that raises relative humidity. So whoever thought, if your particle level's high, put a sweater on and turn your thermostat down. That's not usually an indoor air quality remediation step, but it's a very powerful one.
I have another question about a user group. Not too long ago, I think actually at a Passive House conference, I saw a presentation where they measured the air quality in a gym. I guess they kind of had shocking results, just kind of what bodies emit and how bad that is for your air quality. Is that something that you have investigated at all?
Yes, to some extent. Actually, we have one athletic facility installation, believe it or not, for the military, and we're finding that yes, human bodies emit particles and water vapor and VOCs, which you can smell, which aren't necessarily bad for you, but people generally don't like body odor. Whatever the problem is, manage that specific problem. But in some cases it is ventilation, some cases it's filter and dehumidify. It really depends on what is causing the offending score.
So you would think that in a facility like a gym or athletic facility where it's all about health, that you would monitor the indoor air quality as well.
But people, think about airborne transmission of disease, or it's, a lot of people are really terrified by that concept. And I think it's one of the reasons that it took so long for the World Health Organization, the CDC, to acknowledge that SARS-CoV-2 is primarily airborne. People are much more comfortable thinking about contact transmission because it's easier to, clean surfaces. And even if you're off-gassing bad chemicals, it's easier to hammer people about washing their hands than it is to control airborne. So I think that's why I agree with you.
And one other thing, you've brought up filters in a couple of different situations. Would your monitoring, your dashboard, help people, remind them when it's time to change a filter? Because, you can have all the filters you want, but if you don't change them in a timely manner, they're not going to help anything.
Yes, you definitely can, because you'll see a change in your readings. It'll say, okay, wait, why all of a sudden are my, for example, particles creeping up? That's one of the things I really like about our platform, is that you don't have to just stick to a prescribed schedule. You actually respond or can anticipate based on your individual building. You can anticipate maintenance needs.
Yeah, that's great. That's very important. And smoke events, of course, are a big issue out here. So it's great to have an understanding, if you are trying to pre-filter your air during a smoke event, how effective are you being?
Exactly. And also, are you removing other compounds that can be associated with fires, such as NO2 and ozone? Those are important things to get rid of, as well as the things you can see or smell.
One last question, totally unrelated, but I saw on your bio that you're also a pilot. Is that correct?
I'm a pilot, but mostly I'm a skydiver.
Oh, wow.
So I skydive a lot. My son and I got into it. So I would tell you that if you're going to be a pilot, either be a pilot or skydive. But being a private pilot and then getting into skydiving is really nerve-wracking. Because as a private pilot, you're not used to somebody opening the door of the airplane and jumping out. I love flying. I don't do it so much anymore because you have to do a lot to be really safe. But I do skydive a lot.
Oh, that's amazing.
It was great talking with you both.
Dr. Stephanie Taylor there from Building for Health, and I had a quick look through all of the great information that they have. You can find their content. Building for Health is B, the number 4, H, so that's Building for Health Inc. And you should be able to find it. And I was intrigued to find out what those 11 markers were. And there's a diagram on the website there about all of the interrelationships between everything from temperature to CO2, also carbon monoxide as well as carbon dioxide. O3, we'll talk a bit about O3 because I found that really interesting. Nitrogen oxides, she mentioned, TVOCs, relative humidity, of course, temperature, and then it gets interesting because there are 3 different measures for particulates, all of different sizes. So we've got the classic PM 2.5, but there are also other sizes of particulates which are measured separately. So some really, really interesting stuff. But let's go straight to Ilka and Mary first. Ilka, what were your sort of main takeaways from your chat?
Well, I think what you just described was definitely a big takeaway for me, that it's not about one metric that is good or that makes everything good or bad, but it's like the sum of all of them, and that you can not play around, but that you can adjust certain metrics to make it better. And that it's kind of like a puzzle. And it actually reminded me quite a bit of a WWOOFy model or an energy model, where it's not just, if you don't meet the targets, and it's typically not just one thing that you just tweak a little bit. It's always a combination of a lot of them that makes the whole better. And I don't think I ever thought about indoor air quality that way.
Yeah, I mean, that was a really good example she gave of lowering the temperature on purpose to drop out the, I think it was a particulate concentration, and to have, which has an overall positive impact, which is not what you'd necessarily think, because you've got to stay within these strict parameters of temperature, but having that interrelationship. And of course, we're very, I think we're familiar with that in passive house design and construction when it relates to relative humidity, temperature, and a little bit CO2. I mean, it's not something we measure too much, but it's a really good proxy for the ventilation rate and the adequate supply of fresh air. But when you add all those other things to the mix, that's when it becomes really interesting to have some analytics behind that to see, what is that actually optimal. How about you, Mary?
Well, I just think along those lines, what you don't measure, you can't deal with appropriately. Because if you have some issue going on, but you don't really know which contaminant is it that's causing problems. For instance, I just loved her example. Keep humidity higher on bingo nights because you're getting more particulates on those nights from everybody getting excited and jumping up and down or whatever. It's something you wouldn't think about at all, but until you have the data in front of you.
Well, what I thought you were going to talk about was if you don't measure, you can't be held responsible, which was another scary reality of what she has discovered in her work, that some people just don't want to know, because if you do know, that means you might have to do something about it or be accountable for doing something about it, which I can definitely, unfortunately, see that being a reality in some situations, and that hesitancy to actually quantify what is happening in any building, because suddenly that when it is put in front of you,
you might have to do something about it, which is a good thing. But yeah, that's something we definitely want to encourage. Zach.
So I was struck by a couple of things. One is that this notion of the building's microbiome, and this is something that I remember being struck by when I heard Dr. Taylor speak at the Building Science Summer Camp as well, and just like how like the kind of mind blowing there's all sorts of new understandings and new research going into our own microbiomes, and then to think about how that interacts and interplays with the building's microbiome, it kind of is mind blowing. The other thing is that just how that when we don't have a system, I mean, because I think that Ilka, part of what you're describing was a kind of is the systems understanding of a problem that that's what we're doing when we apply WUFI to buildings, and that's what I think Dr. Taylor is doing in her work. That when we don't do that, then I think that those of us lay people, it's easy for us to come to what seem like logical conclusions that are just kind of off base. And so the two that really stuck out to me were the notion that healthy buildings are ones that don't have rapid ventilation rates, because dry air is hazardous to our health, and those rapid ventilation rates dry out the air. And, that's kind of, I think that there's a knee-jerk reaction to say we need more ventilation, and that's not the case. And then the other was that just that the notion that a porous surface that holds moisture is more likely to handle, is more likely to be free of contaminants or a safe surface than stainless steel.
Without that lead in, I absolutely was thinking stainless steel. It's got to be of course, that's the most hygienic surface.
Yeah. We have this image of what hygiene means, and it's getting shaken.
Well, I guess hygiene is part of. It's only one single part. It's about health and the health outcomes.
Yeah.
Which hygiene is a part of that, but it's not the be all and end all. And you got to consider the what's in the air. And how all those things are interacting with each other in the air. I think she made some really good points. Prevention not being profitable, which is another unfortunate reality that it's not that sexy to prevent things from happening, which is really interesting as well, coming from her medical background, which a lot of doctors are faced with just fixing a problem when it presents itself, as opposed to stepping back and say, hey, what's the cause of this? And what can we do to prevent this from occurring in the first place? And I often tell architects when I get the chance to speak in front of groups that I firmly believe that architects and builders have a lot more impact on people's health than most doctors, because you go and see a doctor when you're already sick, but buildings, because we spend so much time in them, have a good chance of contributing to either making us sick or keeping us healthy. So I really like that, and I also really like the vision and what Stephanie said about the fact that every occupied building should be monitored, and having that objective of really getting some sort of visibility or way to know what's happening in every building that has people in it, and that's so lacking at the moment. So many buildings just don't have any monitoring, or very limited, maybe just a temperature and, if you're lucky, a humidity meter, and who knows if they're accurate or not. As you experienced, I think, Mary, with your sensors.
Right, I have 2 indoor air quality sensors. One was in my bedroom, and one is in my living room, and the bedroom kept registering as if I was having some sort of indoor air quality problem. But finally, we swapped the 2 of them to see, and it turns out that just one was defective.
Yeah.
But it really, what you were saying brings up a good point. There was at LBNL, a recent paper looked at association of residential energy efficiency retrofits with environmental quality, comfort, and health. They did a review of all this previous studies, and not surprisingly at all, they found that a lot of quote unquote energy efficiency retrofits have poor indoor air quality afterwards, because there was no vent. Some of these retrofits were done without any consideration of, oh, we're tightening up the house, and we're not treating the house as a system, and we're not adding ventilation to the retrofit package. And it just brings up the value to me of Passive House again. That does treat the whole house as a system and addresses indoor air quality along with energy efficiency and comfort.
Pretty inspiring woman, from everything from designing buildings to being a doctor and then jumping out of airplanes. So really,
I was just going to
really
say that I'm a non-pilot, and I also am uncomfortable with doors being opened on
doors and planes should stay open. Should not be opened. Yeah. Anything else from you, Ilka?
When she talked about like using indoor air quality as a health metric or a health indicator, and to actually use it to boost your immune system, right? So that it increases your health, basically, to have good indoor air quality. And I don't think that's something that we typically really think about, or even thinking about why we do feel very well in spaces. Like we rarely trace that back to the air that we breathe in, 80% of the time. I mean, it's kind of ridiculous that we don't ever really think about it. And she said, even in the healthcare sector, doctors, when you go and visit for a visit, they rarely ask about, where you spend most of your time. And I think, it all comes back to the monitoring, right? Yeah. Because we're not used to really trusting our instincts anymore, I feel like. So we do need a lot of monitoring and evidence to support how we feel. And if that's the way that gets us there and healthier, I think that's what we need to do.
All right. Hey, well, thank you, Mary and Ilka. Really, really enjoyed that, and fascinating research, ongoing work. As I mentioned, you can check out Stephanie's work, Building for Health. All right, Zach, what have we got coming up?
Yeah, so on Passive House Accelerator Live this Wednesday, so Thursday your time, Matthew, we have a construction tech episode of the show, and we are joined by a rock star from RDH Building Science, Maureen Sanchez, who heads up their Passive House practice. And she's going to be presenting student residences in Passive House, scaling challenges and insights. So please don't miss that one. It's going to be a really great one. She, I think, was the first presenter at the Global Passive House Happy Hour when we first launched that like 3 years ago when COVID just started. So it's pretty cool to have her back. And then keep your eyes open and please join us for the 2023 Passive House Network Conference that's happening in Denver. There's an online session on September 28th, and then the conference itself is in Denver from October 4th to 5th. And we are going to be, a whole team of us from Passive House Accelerator will be at the conference doing a bunch of interviews for the podcast. So we'll have some fun bonus episodes to share with everyone here. Those are being underwritten thanks to generous support from EnterSign. So that's the big conference in October. The big conference in November is TheusCon 2023, and that'll be in Houston from November 7th through November 10th. And we'll be doing a bunch of podcasts there. And so there's going to be some fun content that we develop there. That's going to be underwritten by Zola Windows. And I know, Matthew, you're going to be with us in Houston. So that'll be super fun, too.
Exciting. Looking forward to it. Yeah, and a couple of Australians, I think, are going to be there, too.
A couple of Australians, I know, right? And who is going to be there from Australia? I'm forgetting his name.
Jesse Clark.
That's right.
Will be there talking about some of he's doing some fantastic work talking about moisture control, ventilation, particularly in roof spaces, and how he's using WFI to educate people in this part of the world about vapor control and air tightness and ventilation, and the importance of ventilation, which obviously relates to what we've been talking about today. So, yeah, really looking forward to that.
Yeah, and we featured Jesse on the podcast episode 124. And he was talking about his inspiring kind of building science leadership and promulgation of great knowledge from his perch at Proclima there. So good stuff.
Good stuff. All right, lots going on. Thank you very much. Thanks again to Mary and Ilka for bringing us another fantastic guest. And we'll be back again next week on Passive House Podcast.